Good afternoon, distinguished chairperson and respected colleagues. It is my honor to present clinical pathologic and mammographic features of triple-negative breast cancer and non-triple-negative breast cancer. Here is the outline of my presentation. We know that since 2020, breast cancer have overcome lung cancer to become the highest incident and the most prevalent cancer in the world. Histopathology is a gold standard to diagnose breast cancer. Invasive breast cancer is a heterogeneous disease with 4 main subtypes with different treatment therapy, prognosis, and progression. Gene express profiling is used for determining the intrinsic molecular breast cancer subtypes, but not widely available and very expensive. Immunohistochemistry is commonly used in clinical setting, but has 30% discordant rates with GEP. Percutaneous biopsy sampling we use normally in clinical setting, but does not represent the heterogeneity of the whole tumor, up to almost 40%. There was previous studies show that strong correlation between mammographic features and molecular breast cancer subtypes. For example, calcification cluster likely presented in HER2-enriched. Speculated masses are more likely in lunar A or B, and circumscribed masses are more likely in triple-negative. Therefore, the radiologic image have to adjunct to GEP in pre-treatment planning and also provide an additional level of analysis for radiopathologic correlation indication. Previous study in Western countries where they have national screening program for breast cancer, and Western women are more likely to have hypodense breast tissue. In Vietnam, we do not have national screening program for breast cancer, and Vietnamese women are likely to have hyperdense breast tissue. It's the reason why we conduct a study with 2 objectives. The first one is to evaluate the clinical pathology features between triple-negative breast cancer and non-triple-negative breast cancer. The second one is to evaluate the mammographic features between triple-negative breast cancer and non-triple-negative ones. About the literature review, invasive breast cancer is defined as malignant epithelial neoplasm of the breast. That malignant cell breaks the myoepithelial and basement membrane layers and it turns into the surrounding stroma. There are 10 types of invasive breast cancer, and the no special types is the most common one. About the molecular breast cancer subtypes, there are 4 main subtypes, depends on the expression of estrogen receptor, progesterone receptor, HER2, and Ki67. These subtypes has different prognosis. When we have lunar A has the best prognosis and triple negative has a worse prognosis. Relevant studies in a nationwide screening program with more than 1,000 women with invasive breast cancer, irregular speculated tumors are more likely to be in estrogen receptor positive than estrogen receptor negative tumors with odds ratio equals 6. Other studies show that high-risk calcification is more likely to associate with HER2-enriched subtypes, odds ratio equals 3. And other studies also show that unifocal, circumscribed margins, round shapes, and no associated calcification are signature of triple-negative. And 26.5% was reported that it was misdiagnosed by benign feature on mammogram and as classified as BRCA 3. In Vietnam, there was no previous study implemented. About the material and method of the study, we conduct the study from October 2022 to August 2023 at the Radiology Center in the K Hospital. The study was a retrospective with confidence sample. Here's the study technique. About the participant, we include patients who have 2 views of MLO and 2 views of CC for both right and left breast, and the patient needs to have the final diagnosis in histopathology with IHC results and have the define their subtype classification. We do not include the patient who took the mammography after getting definite diagnosis or treatment, and the lesion is visible on the one side only. Here's a statistical analysis. About the results and discussion, during the study duration, we have more than 2,187 patients has pathology result of invasive breast cancer, and 1,804 patients took mammography, and finally have the 402 patients had mammography with 4 views, and finally we have 364 patients with 367 visible lesions, with 21 non-triple negative versus 46 triple negative breast cancer. About the demographic features, first the patient age, they was about 52 years old between two groups, similar with other study. About the tumor size, that in triple negative, the tumor size was slightly higher, larger than the non-triple negative breast cancer, which was 26.2 millimeter. Pathology type was quite similar between two groups, with the invasive ductal carcinoma was the most common one. And about the grade of invasive ductal carcinoma in two groups, you can see here that in triple negative, the grade 3 has more than 80%, but in non-triple negative, it's just only 25.2%. This result was a statistical difference between two groups. About mammographic findings, here you can see that the mass without calcification was the most findings in triple negative with more than 80%, while these findings were only 61.2%, and the suspicious calcification, we see that with more than 10% in non-triple negative, but only 2.3% in triple negative. This finding also has a statistical difference between two groups, while in other studies they show that in Young et al. That 85% mass without calcification was the finding of the triple negative cancer. About the BRAF category, about 28.3% of triple negative breast cancer in our study was BRAF 3, while it's only almost 2% in non-triple negative. This category also have the statistical difference. About the mass characteristic, in mass margins, that most of the case of triple negative is EUD5 and microlobulated, but 7% of triple negative has a circumscribed margins, while only 0.7% was non-triple negative ones. And about the mass shape, you can see here that 25.6% of triple negative has an oval mass shape. Is a very benign features of breast lesion, and this rate only 5% in non-triple negative. The characteristics also have the statistical difference. It's the result in my study also similar with other study. About the case study, the first case, that a woman has a lunar A subtype and has a speculated irregular mass in their mammography. The second one, that the woman has a HER2 enriched subtype, but the mammography have the obscure irregular mass with suspicious calcification, which were amorphous and the 5 linear in segmental distribution. And the last case is a triple negative breast cancer, that the patient has a round mass with circumscribed margin, which were classified as BRAF 3 at first. Conclusion, triple negative breast cancer can acquire mammographic features with lowly malignant suspicion due to their aggressive and rapid growth. Radiologists need to have wide range of knowledge in triple negative breast cancer imaging to detect early these poor prognosis subtypes. Here's a reference. Thank you for your attention.